Hello, Dementia Matters podcast listeners. Thank you for returning to the podcast during this COVID-19 pandemic. I know you have a lot on your mind, and despite being at home, I know life is not easy. It's an understatement to say we are living in an extraordinary time, but whatever you want to call this ongoing experience, it is asking extraordinary things of us. And life doesn't just stop because of it, which is why this podcast continues. I want to pivot here on Dementia Matters and address important issues affecting those with cognitive impairment and those without during this COVID-19 coronavirus pandemic. I cannot cover all the issues and frankly shouldn't. I encourage you to go to trusted sources for specific information, such as the U.S. Centers for Disease Control and Prevention, your state and local health department websites, and the Alzheimer's Association. You can also find resources on our website at adrc.wisc.edu. That's adrc.wisc.edu, and that of the Wisconsin Alzheimer's Institute at wai.wisc.edu. For other interesting and important stories on the COVID-19 pandemic, I would recommend my colleague at UW Health, Dr. Jonathan Kohler of the Surgery Set podcast, who has a special series called The Front Lines of COVID. We will include these links to all these resources in our show notes. For those of you affected by Alzheimer's disease or any cause of cognitive impairment, you know better than anyone that it takes a community to care for those affected and to work on the front lines of treatment, prevention, and cure. What we face with COVID-19 is no different. We all are needed in this fight, and I thank you for whatever it is that you're doing. Take care and be safe. My guest today on Dementia Matters is Dr. Andrea Gilmore-Bykovskyi, an assistant professor at the University of Wisconsin-Madison in the School of Nursing. Dr. Gilmore-Bykovskyi is a researcher and Rec Scholar in the Wisconsin ADRC. She leads a research program focused on promoting effective and meaningful care for people living with and at risk for dementia, particularly among higher risk and underserved populations. Welcome back, Dr. Andrea Gilmore-Bykovskyi, to Dementia Matters.
Thanks so much. I'm so happy to be here.
I'm grateful to have you on the show today, and while the circumstances are not ideal and the COVID-19 pandemic continues in full force, I believe your experience and input is critical right now. On today's program, I want to focus on tips for dementia caregivers during this shelter at home or safer at home, or whatever terms people are using right now. And even if those restrictions are not in full force, the information I believe you have is relevant still post-quarantine.
On the front of my mind is the importance of acknowledging that this is a really stressful and challenging time for many of us. And this is an important time for us to be generous and kind to ourselves. As we know, many caregivers are already sometimes facing difficulty with the many important things that they do to support their loved one with dementia. And one thing that I think can be quite helpful to take into consideration is that the person with dementia is also responding to and really working to understand the new normal, just like we all are. Many of the changes in routines and familiar faces will certainly be noticeable to someone with dementia. So one thing that we can take into consideration is how we might anticipate that the loved one with dementia we're working with might respond to some of those changes, and expecting that there might be some differences in behavior or mood and some different supports that might be needed as that person works to adjust.
And would you also say that, while it's difficult for all of us to really cope and address the things that are happening, someone with a cognitive impairment is also going to be confused about the response from their loved one. So they might be responding because of the response of the caregiver.
Oh, absolutely. And there's a fair deal of evidence that demonstrates that the mood, the level of stress that a caregiver is experiencing is certainly experienced and felt by the loved one with dementia. So one thing that I think is really important is to really work as best as we can to prioritize our own self-care, because we know that that will have consequences for our loved one with dementia, the better that we care for ourselves, the better we are able to support that person. I think there are also, some considerations with regards to recommendations from the CDC and public health experts that we need to be mindful of when working with someone with dementia and supporting them. So, some of the changes including more use of hand sanitizer, more thorough hand washing, differences in what we do when we go outside with social distancing and physical distancing from others. These are things that will require some repetition and gentle reminders for this person to become used to. And these are also things that someone may notice are different than how we usually behave. So I think we need to think about the words that we use to explain these new and different behaviors in a way that isn't alarming or too confusing to our loved ones with dementia.
That's such a good point, because there are new behaviors that we're asking of everyone with particular hygiene and social distancing. But I do want to go back to one of the earlier parts of your answer with self-care. So, because it's such an important thing. We know our caregivers need to take care of themselves as well. So how should caregivers be providing self-care really as a way of direct care to the person that needs their assistance?
Absolutely. It's so important. It's important for all of us all the time, but even more so right now. I think, anything that someone can put into place that offers a bit of respite, a bit of laughter. I really feel this is a time to pull out all of the stops. And a couple of ideas that I have that I'd like to share with folks are thinking about outlets that really help you maybe experience a different form of stimulation. So music is a wonderful example, a wonderful outlet that perhaps if you're interested in music that doesn't seem helpful for the loved one with dementia and you're in a close space, maybe you can use some headphones to still listen to music while you're engaged in activities. We know that social contact is really vitally important for our well-being and health, having a sense of connection to others. And anything you can do to maintain contact with friends, family, neighbors. This could be establishing a new letter writing with somebody perhaps that you're used to seeing on a normal walk that you can't see anymore. It could be upping the frequency of phone calls with family or friends. And I know that sometimes, when we're caring for someone with dementia, it's really hard to carve out time that feels protected, especially when we are confined in our homes together more often. So, thinking if there are ways that you can maybe shift your schedule slightly. This might be waking up just a little bit earlier, even 15 or 20 minutes of a bit of quiet time to yourself might make a difference, and finding ways to make that special for yourself, whether it's, that you're going to start that time by watching the birds out the window with a little bit of meditation or a prayer, or maybe writing down some statements about things you're grateful for right now is a really nice idea of ways to squeeze things in when it can sometimes feel hard to make those things fit.
No, so those are excellent recommendations. And I think one of the things you're also speaking to is that we are confined into like a limited space. And that can often lead to problems in and of itself. And so I guess I'm wondering, do you have recommendations for communication strategies since the caregiver and this care recipient are really now in close contact with each other and may not be able to get as much time alone as they're used to?
Definitely. I think, some ideas are finding ways to fill some of that void. Again, I want to bring up music as a wonderful outlet and something that we know often has benefits for the person with dementia. Another idea might be trying to think of some books on tape or a podcast perhaps that might be of interest that can provide some background noise for folks for whom it's hard to keep up with offering ongoing stimulation. I know that can be quite tiring sometimes. other ideas. This might be a time where, if you are working with a loved one who really enjoys a particular favorite TV show that they've watched for decades or many years, this might be a time to rerun some of those episodes, even if you're looking at them repeatedly. So thinking about ways that you can alleviate some of the burden on yourself as a caregiver for needing to be sort of the source of all entertainment during the day, I think is really, really important during this time.
Yeah, those are great recommendations and actually could apply to all of us. It makes me think that maybe I should go back and watch some of my favorite shows, mostly comedies, to kind of bring some laughter into this whole pandemic.
Perhaps. I think humor is, I use it as a clinician in practice very often. It's important for us to find ways to enjoy the benefits of laughter. So if you're someone that is into comedies, I know that there are many sort of comedy oriented podcasts. I haven't been able to explore many, but also, through film and through other media, finding ways to still have laughter is really important.
Doing a little pivot here, Andrea, how is the pandemic impacting caregivers from underserved populations differently?
Yeah, that's an important question. And, something that's unfortunate is it appears that we don't, as of yet, have ideal, robust, and representative data about how COVID 19 is impacting persons from more underrepresented groups. So, thinking particularly about racial and ethnic minority groups, individuals who may be immigrants or may be undocumented. There is emerging evidence from several areas to suggest that we're seeing some really significant disparities in how these communities are being affected. And we know that these communities experience a range of other significant health disparities that seem to be, perhaps in a way, increasing risk for exposure to COVID 19. But it seems likely that there are also other important structural and systemic ways in which some underrepresented groups are being impacted at higher rates. And this includes things like the benefit of being able to stay home. We know that if perhaps you are struggling socioeconomically, you may have individuals in your family who can't stop working, or they may be more likely to work in some of the roles that we're discovering are really critical for our society to sustain itself. I think that the hope is that there will be broader data available as states improve their reporting systems. But also, I think there are calls for us to really continue to be mindful of and re-energize our efforts to address the underlying causes of higher rates of disease in some of these communities, which stem well beyond things like pre-existing
Yeah, and I
conditions.
mean, you're speaking to the social determinants of health, which we know is so critical in providing adequate and good care to all the people.
It's really, really essential, and these are things that operate in terms of geography, where you live and what you have access to, your financial means, aspects of your identity that might change opportunities you've had, and the way you've been treated. And what we're seeing now with COVID-19 is that these things don't go away during a pandemic, and in many ways they seem to be perhaps exacerbated. So it's certainly very concerning.
And speaking of systems, when I'm on the phone with some of my patients, a lot of caregivers are expressing fear about having to bring their loved one to the medical clinic or even to the emergency room. Do you have any recommendations for caregivers to help them plan for a needed trip to an acute care place like that?
Yeah, I definitely do. I think that it's a really helpful all of the time to plan for potential emergencies and different types of emergencies. We know that a recommendation at this point is that folks really try to prioritize calling their healthcare provider before making a trip into the clinic or into an emergency room. The purpose of that initial call is really to see what can be done to reduce burden on the healthcare system and to ensure and provide some clarity around whether or not this requires an emergency room level visit. There is increasing use of telephone-based visits to address many even more urgent, but not necessarily emergency level medical challenges. Of course, situations can arise where, a trip to the emergency room really is warranted, and having a plan in place as to who you will notify, how you will get there, a bag that you have packed and ready to bring with you that includes some familiar items to the person with dementia, in addition to anything that might serve as a useful distraction during that time, are some things that I think we can have in place so that it feels a bit less alarming when we're encountered with that decision making and that transition into the clinic or the emergency room.
Now, you also have experience working with and training staff in the hospital for people who are admitted from the ER. Now, with our current situation, many families cannot visit their loved one in the hospital due to the strict but needed precautions of limiting exposure. Now, what kind of advice can you give families wanting to communicate with their loved one while hospitalized?
Yeah, this is a really important question, and for me, this is one of the aspects of this particular situation that's really really challenging for all of us to understand and cope with. We all want anyone that we're caring for in the hospital to have access to their families. We know it's so important. So I think some things that we can do when we know that we can't be physically near are really maintaining those lines of communication with the care team. So this includes being proactive, and knowing that you have the right to call and to be connected with your loved one. And this could be as simple as your voice in the background when your loved one is in their room. Whether or not they're able to respond to you at that point in time, we know that presence of familiar persons is a really potent intervention to support people when they are needing acute care, and they're acutely ill, as people in the hospital are. And we are seeing in many settings, in particular in nursing homes, the use of much broader use of video technology to facilitate social connectedness. So while we need to be physically distant, it does not mean we need to be socially distant and separate from one another. And it may take several calls. It may take some trial and error, but really knowing that you certainly have the right to have that connection.
I'm glad you mentioned the nursing home in that answer for hospitalized patients, because it is still an institutionalized environment, and technology still is important in the nursing home or assisted living. Do you think there are other considerations that families should consider if their loved one is not acutely ill but is living in assisted living or a nursing home?
Absolutely. I mentioned letter writing. And I know it sounds a little bit old fashioned, but I think that there can be something really meaningful and therapeutic with that form of communication and the words that you share and the time you have to reflect in writing someone a letter. You could also consider recording a note to someone and having that sent to the nursing home or assisted living. Very often, staff are accustomed to opening mail in those settings and helping folks that need that help to digest that communication. And I think that those are other things that you can consider adding in addition to phone and sort of this video based communication. And I think we're these are uncharted waters for all of us, and I do believe that providers, nurses, and staff in these settings are hopefully quite open to. Hold on, let me try to restate this. These are uncharted waters for all of us, and understanding that staff in these settings are also new to these expanded and different forms of communication. And really, this is also a form of care for the individuals living in that setting. Connection to family is incredibly important for well-being and family and quality of life. So a little bit of patience, and as we work to advocate for these different forms of communication, realizing that everyone's learning.
I think that's a really good point, and I think that's a fantastic recommendation when you think about trying to meet our loved ones where they're at in their cognitive journey, but also just in what they're comfortable with. A lot of the people in assisted living and nursing homes happen to be older, and in that generation, letters were the common form of communication. So I think that's actually a nice throwback to what they would actually be most accustomed to.
Absolutely. And, one other idea that I had provided to someone I was working with was the idea of going back through some old albums or other important memorabilia in your family. And this might be a time to, take some of those old pictures out and reflect on different times, knowing that we are all collectively going to enter a new form of normal when we're through with COVID-19. And we all hope that sooner than later, but this is a time to think of some really important memories, and perhaps taking some of those pictures and, talking about that memory and sharing that with a loved one in assisted living or a nursing home setting. That may trigger some important memories for them, but it also triggers important memories for us that are important to acknowledge and to have some space to appreciate.
Oh, that's a wonderful idea. And you're right, everyone does benefit from being able to reminisce about those things. I guess to end, Andrea, what do you want caregivers to know after this pandemic ends and we're on the road to recovery?
So I think that while there are many, many challenges here, as we also have witnessed and many of us personally experienced the challenges that take place in the journey with dementia as well, I think that we also are going to find many things to celebrate. And it's something that is really hard to do. And I know that I personally am not the best at it, but finding ways to celebrate our resilience, our strength. Some people might call this grit. And I think that we're all going to grow in ways that we maybe did not anticipate we might have had to grow. And I think that we're going to have new opportunities to see ourselves and our capabilities in very different ways. And I think that there's something really positive in that. And I think that we can also try to do that along the way, individually and with one another.
Well said. And thank you again, Dr. Andrea Gilmore-Bykovskyi, for joining us on Dementia Matters, and I do look forward to having you on in the future.
Thanks so much.
Please subscribe to Dementia Matters on Apple Podcasts, Spotify, Podbean, or wherever you get your podcasts, and rate us on your favorite podcast app. It helps other people find our show and lets us know how we're doing. Dementia Matters is brought to you by the Wisconsin Alzheimer's Disease Research Center. The Wisconsin Alzheimer's Disease Research Center combines academic, clinical, and research expertise from the University of Wisconsin School of Medicine and Public Health and the Geriatric Research, Education, and Clinical Center of the William S. Middleton Memorial Veterans Hospital in Madison, Wisconsin. It receives funding from private university, state, and national sources, including a grant from the National Institutes of Health for Alzheimer's Disease Centers. This episode was produced by Bonnie Nutkinson and edited by Bashir Adine. Our musical jingle is Organisms by Chad Crouch. Check out our website at adrc.wisc.edu. That's adrc.wisc.edu. You can also follow us on Twitter and Facebook. If you have any questions or comments, please email us at dementiamatters@medicine.wisc.edu. That's dementiamatters@medicine.wisc.edu. Thanks for listening.